Hi, my name is Newton Fahl, and I am here to share with you the tip of the month. And it'll be direct veneer made simple. I want to share with you a technique that is very predictable and easy to accomplish. So our exercise will entail doing a direct veneer on a tooth that has a good color base. It does not have a discolored substrate, and all it requires is a change in form. The first thing we need to evaluate is the color variation from cervical to incisal. So I look at the cervical 1/3 and I perceive a slightly higher chroma in this area, which phases off towards the middle third and towards the incisal 1/3. So in a diagram, this is what I would do. I would add a little bit of light brown, very sparing amount on the cervical. This will help emphasize the chroma just the right extent that I need. Then one single shade of A1 Renamel microfill covering the cervical middle and incisal thirds, partially being cut back over that incisal 1/3. So this would be a body enamel. In this case, we'll be using Renamel microfill A1. So that cutback allows me to do some tinting, and I can use a little bit of violet to impart some translucency in between the mamelons, and then a final layer of an achromatic enamel, something like Renamel incisal medium, will be used. And because it is fairly translucent, it'll pick up both part of the body enamel and part of the mamelons that I will have sculpted in, and then the translucency from the tints. So this is what I would do from a facial aspect. The tinting with light brown, just enough to add a nice warmth to that cervical area. And then the body enamel that will come over the tint, over the cervical. This is Renamel microfill A1 going towards the incisal. And then remember, I can cut it back and create the shapes of the mamelons by simply putting in depressions and changing the height of the tips here, so I can mimic mamelons with a body enamel and not with a dentin substitute. That too will help me create some nice effects incisally. Then I will use a little bit of tints, in this case violet, just enough to impart some translucency. Obviously, this is only two-dimensional because there is no true translucency from a composite mask, something like occlusal clear or any other material that would allow the light to go through. But nonetheless, we'll be able to pick up some of that color. Then, as a final shade, I will use Renamel microfill incisal medium just over here, and that will conceal all the shades that I have underneath it while imparting some nice depth and translucency. So this creates a nice polychromatic veneer using tints and only two composite masses. So the first step is to use creative color light brown on the cervical. Let's see how that's done. Okay, so we will take a number 1 brush with a light brown tint and we'll put it on and brush it on and then brush it off. I usually say that the maxim about tinting is this: if you can see it, it's already too much. So just enough to impart that warmth we want on the cervical. The body enamel then will be Re-Enamel Microfill A1, which is the shade I selected for this specific acrylic model. You have to select the one accordingly to the case that you're working on. A nice way of working with a composite is by squirting it on the resin keeper, then picking it up with your fingers, with your gloved fingers, rolling it into a ball, and then using it on the tooth. By doing this, you will have less chances of incorporating voids, and it'll become so much easier to sculpt it. So we'll take the body enamel, put it on the tooth, and then just press it with your favorite instrument. I happen to like this flat spoon end instrument, and also there is a spatula end that I can work with. And then you will sculpt it until you get the facial contour. So give it the full contour before you can cut it back along the incisal 1/3. So you continue to work until you have pretty much the full contour, and then just sever off the excess on the incisal so you can have the facial contour almost to full contour. So we need to continue to work with our instruments until we get to the primary anatomy. That is the final form of the tooth. So we may consider this as the final veneer, except that it won't have any translucency to it. But if the form is good, it would be a very nice restoration. However, what we want to do here is to cut back the incisal 1/3 and add translucency by virtue of tints and a translucent shade of composite. The cutback is done with an IPC. I like the long IPC better. And I will slice off the body enamel until I can see the tooth preparation underneath, which indicates that I have enough room for another layer on top. So I'll continue to slice it until I remove a good amount and I have just the right thickness for the value enamel, or as we call it, incisal medium enamel. So I did one slice over the incisal, and then I'll slice off some more of the proximal, both mesially and distally. So depending on how much translucency you may want, you need to cut more or less back. In our particular case here, I'm going to aim at having an intermediate degree of translucency. So I'm not really cutting off a whole lot. I'm just removing enough to add a moderately thin layer of the incisal medium enamel over it. So when we're done cutting back, we can take a PS multi-use instrument and just put little grooves, little indentations to mimic what the mamelons would be right along the incisal. And this will help me to pull to some extent the tint, and that will create the beautiful translucent effect that I want. So we do this very gently, and then we can light cure. So next we will squirt a little bit of the violet tint onto the resin keeper and just pick up a very small amount for the incisional translucency effect. And the key here, and here's a very good tip, is not to let it pool too much in between the depressions. You want to paint it on, brush it on, and then just go back and brush it off. And we can create whatever effect we want by making it more subtle or more marked between the mamelon areas. If you think you've put too much, just go back and brush it off. And for this exercise, the very final shade will be incisional medium. It's got this nice achromatic look. It is just of the right translucency to pick up the underlying mamelon shapes and colors and the translucency from the tints. So overall, this is one of my favorite shades for when I'm doing an incisional layering. It really makes it lifelike and nice looking. So the key when applying this last shade is not to be shy. In other words, you need to add as much as necessary to finish up the final facial anatomy. If you need to carry it all the way to the cervical third, that's okay. What you do here, and this is a good tip, you need to tack it down over the cervical third, because this is where the emergence profile is already finished, and then you can move it around without dislodging it. So it'll stay put even as you move it because it's been tacked down over the cervical third. Very important tip, that one. So keep working, then you keep pressing into your embrasures. Clinically, I would probably have a milder strip in between the proximal areas so I could pull it through and get a tight contact. Since this is an acrylic tooth, for the sake of this exercise, I don't have the milder strip. But this is just something that is very helpful to keep a milder strip in between the proximals. When you're done sculpturing the facial aspect, take a brush, a flat tip brush, and you can use a little bit of brush and sculpt, which is like a modeling resin, very sparingly on the brush, and then you can take care of your flat planes, your light reflecting areas and light deflecting areas. So I just take the brush and I go into the embrasure and I work the light deflecting area here, then I flip it and go into the distal facial embrasure and take care of that light deflecting area, and in between the line angles going from cervical to incisal. That really creates a nice and smooth surface so I can then better finish it. So now we will proceed to the finishing stage, and I want to share with you a few very good tips on finishing techniques, especially in that it pertains to getting the proper shape, the proper primary anatomy, and then move on to secondary anatomy and the finishing and the polishing. So the first thing we want to do is to establish the position of the facial incisal line angle. So I'll take a pencil and I'll draw a line along the facial incisal line angles of both centrals. And I need to look down from an incisal view and see if they are in alignment. With the large disc, I will finish this incisal back until the facial incisal line angle of the central I'm working on is flush with the adjacent tooth. The next thing you want to do is to pencil in the transitional line angles on the facial of the tooth you're emulating, and then just try and copy their position on the veneer according to the same position and inclination, and that will be your guideline to getting your light reflecting and light deflecting planes. Okay, so to open the facial embrasure, I'd like to use a 1/2 inch disc. That gives me the ability to work a little better around the embrasure. So I just go in and widen the embrasure until I get to the line which I drew, and that gives me a nice opening, a nice curvature, and I can evaluate it from an incisal view, and that tells me that I have the same inclination on the mesial of the central as I have on the veneer. And I do the same thing to the distal aspect. Next, you should draw lines to divide the facial aspect into 3/3, and that will guide you in the visualization of the facial planes, namely the cervical, middle, and incisal 1/3. With a large disc, then I start from cervical to incisal, working the emergence profile and the curvature of the facial aspect. And that finishing is done until the 3 planes, cervical, middle, and incisal planes, are flush with the facial planes of the adjacent central, as we can see from a side view here. This step usually gives me pretty sharp line angles, so I need to go back in and very gently round off the sharp corners, the sharp edges that I have, so that they become more natural and they flow better from proximal to facial. So we do that to the mesial, and we do that to the distal line angle. And we can see from an incisal view how nicely the facial flows into the proximal aspects. At this point, I have the line angles where they should be, so it's time for me to work on the incisal embrasures. So I'll take a 1/2 inch blue disc and I go into the embrasures and I start rounding off the point angles. I can round them off, try to make them symmetrical, so the same curvature I have on the distal of this central, I'll try to achieve here on the distal of the veneer. And the blue disc, flexidisc, is really nice to do this because it flexes just right without taking away too much composite. Well, now is the time to put in the secondary anatomy. So again, just for the sake of having some anatomical reference, I pencil in the transitional line angles once more, and then I draw the long axis, which is the center of the tooth right there. Then I put in the developmental groove. I can see a developmental groove going up like that, so I'll try and mimic that right there. Looks like a nice depression up to the middle third. Not so obvious, not so marked on the distal there. So this is sort of a map that I use. I can then take a flame-shaped diamond. It doesn't really matter what you use, if it's a carbide or a diamond burr. I like to use super fine and fine diamond burrs. This is an F888. And I just go in very gently and start putting in the developmental groove, the depression, trying to mimic that which I see on the mesial groove of the adjacent central. So just do that very gently. Okay, so that in itself creates a nice texture as well, so which is the tertiary anatomy. The next thing I want to do is to put a little bit of water and take FlexiCup, the blue FlexiCup, and go over the entire facial, smoothing out any striations and irregularities that I see. This will be especially beautiful if you do it over the lobes, because the lobes are usually more pronounced in shine, they're more glossy, and doing this will help to smooth out the lobe areas and also the cervical area. So you take the blue FlexiCup and you sort of go in sub G like that, and that should smooth out some of the undesired texture. So another tip for you is to take enamelize and smear it on the facial, and then to take the pink FlexiCup and go over it, and you can do both finishing and polishing using enamelize as a lubricant. It'll do a couple of things for you. It'll help to polish and finish to some extent. So you just keep working into the embrasure areas, your developmental groove areas, that will bring a very nice gloss, a very nice shine onto the veneer. So now we move on to the very final stage, which is again a little bit of enamelize, and then we'll take FlexiBuff and we'll start, and this is key, with circular movements, high speed, very light touches, and as the polishing paste starts to splatter, we increase the speed and decrease the pressure. That really brings about a very, very nice shine. And re-enamel microfill, being a microfill, obviously, will have the utmost gloss, the utmost shine that you can expect for any composite material. Okay, so as a very, very final step, you want to take FlexiBuff dry, no enamelize on it, and just go over the veneer one final time with it dry. Try to use circular motions, high speed, light touches, and you will see a beautiful gloss, a beautiful shine, and your veneer will look like the real thing. So folks, that's it. We're done. This is the final veneer, and it's very natural looking, nature mimicking, and this is the tip of the month that I'm sharing with you. I hope you've enjoyed it. Thank you very much for watching.
When your first choice is